I had a hip replacement on the same side as my stroke 6 weeks ago. Do you have any experience with this? I am still in a lot of pain. I thought hip surgery was supposed to decrease pain. What challenges should I expect? So, not uncommon. I'm thinking that maybe this is due to a fall because most of the time people have arthritic changes. It's sometimes on the other side. I'm not sure. Or no, you said that it was because of hip pain. So let's break this question down. Do I have experience with this? Yes. The reason you're still in a lot of pain is because surgery is painful. So if you had pain going into the surgery, yes, there is a good chance you're going to have pain coming out of the surgery. And that's why I always talk to people, or really engage in a lot of conversation with my patients, like just going through the pro and con list. So arthritis in and of itself is not always painful. And in fact, I work with a lot of older people where I can hear their bones rubbing on each other. Zero pain. So pain is multifactorial. And that's why I always caution people is that it's not always structural. And so just going in and fixing a structural problem when potentially there are other things that are contributing to that pain, I just think can be problematic. So the good news for you is it's on your stroke side. A lot of times for people that I see, it's on their unaffected side. And so now they don't have stability on one leg because of a stroke, and they don't have to feel like they have stability on another leg because they just had a total hip replacement. So don't expect that pain's going to go away right away. And in fact, it sounds like in your case, 6 weeks, if you were completely healthy, because I've worked quite a bit with people that have had total joint replacements in like the non-stroke population, just from some of my previous jobs, 6 weeks is a long time to still be experiencing pain from a total hip replacement. So my suggestion would be to start looking at other factors. Do you have neuropathic pain? Did you have pain, after your stroke, but that is similar to the pain you're having now? So pain that you didn't have before your stroke, but that you started to have after your stroke, is it similar to that pain? I would start looking at things like that. The other thing that probably might be a contributing factor is that you had this hip replacement on your stroke side and you don't go back to normal activities because it is your weaker leg. So, I'm just thinking kind of problem solving in my head right now, brainstorming a little bit. That could be a potential problem. You do have to walk. That is one of the high recommendations for managing pain after a total hip replacement. So that's potentially a problem. But, I would be patient. I would get as much walking in as you can. We do know that inflammation is a contributing factor to pain. So if you eat a lot of ultra processed foods, not getting enough sleep, not drinking enough water, all of that increases pain. It puts pain chemicals in your bloodstream. So there are inflammatory chemicals that our body uses when we have an injury. I've made a video on this. So those are necessary to heal tissue. And part of that healing process is a chemical that causes pain, because if you think about it, if you have an acute injury, you want to avoid putting any stress on that damaged area. So there is a chemical in that inflammatory process that actually causes pain. Now, in normal conditions, all those chemicals kind of leave the area as the area heals. If they don't, then you might have lingering pain. You're also going to have decreased healing. So that could be one reason why you're still having pain. Not moving helps to kind of move some of that blood out that's carrying some of those like inflammatory chemicals. The other thing is your diet. Ultra processed foods will increase systemic inflammation, and that's when this immune system in our body just kind of goes haywire and just sends inflammatory chemicals all over your body and anywhere. That is a potential problem, and we know that's a contributing factor to pain. So as much as possible, without making your life miserable, getting ultra processed foods out of your house, I think, is Very, very important for anyone who's trying to recover from surgery, and really just as a lifestyle behavior moving forward, because when they're in your home and you're not moving and you're in pain, you are going to gravitate to those more hyper palatable, tasty, salt, fat, sugar ridden foods, because that is what we do. There's a lot of reasons why we gravitate towards those foods, but I would say you're probably gravitating towards those foods more now because you're frustrated, you're in pain. So I would just say get them out of your house, just set yourself up for success. Switch as much as possible to whole, unprocessed foods or minimally processed foods. That means anything on the outside of the grocery store. Try and stay away from buying foods that are in the aisles. Anything that is shelf stable is considered a processed food. Some people say that any food that has five or more ingredients technically is probably ultra processed as well. So just keep those things in mind when you're going to the grocery store. Lunch meats, deli meats, processed. Try and stay away from a lot of those foods. And that does help a little bit with pain. So I would just stack as many factors as possible as you can. The movement one, you're kind of at a disadvantage a little bit as to compared to someone who hasn't had a stroke that has a total hip replacement. So you really need to stack a lot of these other things, drinking plenty of water and getting plenty of sleep, trying to get most of your sleep between 10 and 2, if at all possible, 10 p.m. and 2 a.m. So maybe not staying up late if you can go to bed earlier. Those would be things I would say to just kind of stack in your favor. All right, now about exercises. Because you're probably not walking as much as someone who hasn't had a stroke that has a total hip replacement. I would do a lot of exercises sitting and laying down if you can, laying on your back, marching. I don't know. It depends if you had a posterior approach or an anterior approach. Only you would know this, but if you had a posterior approach, go listen to your physical therapist as far as alternative exercises that you could be doing during the day. You do have some restrictions on movement that you can do, but if you know you had an anterior approach, doing some maybe seated marching a little bit, that would be beneficial. If you can get to a gym, doing an arm bike, just strapping your arms to the bike just to get movement, getting your heart rate up a little bit. They have them in physical therapy gyms. They're called UPEs, but they also have them in a lot of regular gyms now. So I would do that, and then I would walk as much as possible. If you aren't using a walker, go back to using a walker for a short time just so that you can get that distance in. So hopefully that was helpful. Sorry you're going through this, but hang in there, don't give up, and just keep pushing one day at a time. Surgery is not fun, so just don't give up. If you liked that video and you want to learn more exercises on how to improve your walking, definitely check out this video over here or that video over there. If you want even more help, check out our Gold membership program where you will get access to over 300 exercises that are not here on YouTube, as well as access to our monthly lives where you can get your questions answered.